a sudden and devastating blow: the end of USAID programs in Congo. The Democratic Republic of Congo was heavily reliant on aid from the United States Agency for International Development, USAID. For years, USAID had been a lifeline for millions of Congolese, providing essential services and supporting vital development projects. Then, in a shocking turn of events, the Trump administration abruptly terminated hundreds of USAID programs in the country. The impact was immediate and devastating. Programs addressing critical areas such as agriculture, healthcare, education, and conflict resolution were shut down without warning. Clinics and hospitals that depended on USAID funding to provide essential healthcare services were forced to turn away patients. Schools that had received USAID support to educate the next generation saw their hopes for a brighter future vanish overnight. Chaos in Kinshasa, USAID staffers abandoned and in limbo. USAID staffers, many of whom had dedicated their lives to serving the Congolese people, found themselves abandoned and in limbo. With their programs abruptly terminated, they were left with no clear instructions, no support, and no way to fulfill their commitments. Fear and uncertainty gripped the USAID mission in Kinshasa as staffers grappled with the sudden turn of events. Many staffers, fearing for their safety in the midst of growing political turmoil, were forced to flee the country. Those who managed to escape found themselves stranded in Washington, D.C., their lives upended, their careers in tatters. A nation in crisis, the human cost of USAID's closure in Congo, the abrupt termination of USAID programs in the Democratic Republic of Congo has had a profound and devastating impact on the lives of millions of Congolese people. The most vulnerable segments of Congolese society, particularly women and children, have borne the brunt of this reckless policy decision. With health care facilities shuttered or operating with skeletal staff and limited supplies, access to essential medical care has become a luxury few can afford. Pregnant women are forced to give birth at home without access to skilled birth attendants, increasing the risk of complications and maternal mortality. Children are succumbing to preventable diseases like measles, malaria, and diarrhea due to a lack of vaccines, medication, and basic healthcare services. The education sector has also been severely impacted, jeopardizing the future of an entire generation. Legal battles and uncertain futures. The fight for USAID and its mission. Opposition has emerged against the Trump administration's decision to gut USAID. Lawsuits challenge the legality of dismantling USAID, citing political vendettas and rule of law violations. The fight to save USAID is a fight to save lives and uphold American values.